Hello guys, and welcome back to my channel Medicide. Our today's topic is purpura. Purpura is a condition of red or purple discovered spots on the skin that do not blanch on applying pressure. The spots are caused by bleeding underneath the skin, secondary to the platelet disorder, vascular disorder, coagulation disorder, or other causes. The word purpura comes from Latin purpura, meaning purple, which comes from ancient Greek. Purpura is a mass noun named the condition or state, not the name of an individual spot. They measure 3 to 10 mm, whereas petechia measures less than 3 mm and ecchymosis greater than 1 cm. Purpura is common with typhus and can be present with meningitis caused by meningococci or septicemia. In particular, meningococcus caused by Neisseria meningitis, a gram-negative diplococcus organism releases endotoxin. When it lyses, endotoxin activates the Hedgeman factor, that is the clotting factor 12, which causes disseminated intravascular coagulation, that is DIC. The DIC is what appears as rash on the affected individuals. Types of purpura. Purpura are a common and non-specific medical sign. However, some mechanisms are commonly involved. They are platelet disorder, that is thrombocytopenic purpura, which includes primary thrombocytopenic purpura, secondary thrombocytopenic purpura, and the third one is the post-transfusion purpura. Vascular disorders, that is non-thrombocytopenic purpura. This includes microvascular injury as seen in the senile or old age purpura when blood vessels are more easily damaged. Hypertensive states, deficient vascular support, vasculitis as in the case of Henoch-Schönlein purpura. Coagulation disorders. This includes disseminated intravascular coagulation, that is DIC, scurvy, that is caused by vitamin C deficiency, which causes defect in the collagen synthesis. Due to the lack of hydroxylation of procollagen, results in weakened capillary walls and cells. Meningococcemia. Clumping fibrillary protein deposits caused by amyloidosis. Cocaine used with concomitant use of the one-time chemotherapy drug, and now the veterinary deworming agents such as levamisole can also cause purpura in the ears, face, trunk, or extremities, sometimes needing the reconstructive surgery. Decomposition of blood vessels, including purpura, is a symptom of acute radiation poisoning in excess of 2 grades of radiation of exposure. This is an uncommon cause in general but is commonly seen in victims of nuclear disaster. Cases of psychogenic purpura are claimed to be due to autoerythrocyte sensitization by some. Other studies shows that the local or cutaneous activity of tissue plasminogen activator can be increased in psychogenic purpura, leading to substantial amount of localized plasmin activity, rapid degradation of fibrin clots, and resultant bleeding. Petechial rash is also characteristic of rickettsial infection. The causes. The purpura due to low platelet count includes cancer, bone marrow transplantation, HIV infections, chemotherapy, estrogen therapy, hormone replacement therapy, and some medications. Diseases that impair bone marrow function may restrict the body's ability to make platelets and attack bone marrow, such as leukemia, aplastic anemia, myeloma, bone marrow tumors. Symptoms of purpura. The main symptoms of purpura is a purplish red rash just beneath the skin surface. The rash can appear anywhere on the body, including on mucous membrane such as the lining of the mouth. The symptoms that sometimes accompany purpura can help identify its cause. Patients who experience purpura with any of the following symptoms should seek immediate medical treatment. Low platelet count, which may lead to increased bleeding after an injury, bleeding gums or nose, or blood in urine or the bowel movement. Sore or swollen joint, especially in the ankles and knee joints. Gut problems such as nausea, vomiting, diarrhea, or stomach pain. Kidneys problems, particularly protein and blots in the urine. Excessive tiredness. Complications of purpura. Because purpura can signal any underlying medical problem, it may lead to complication if left untreated. When purpura is the result of a blood clotting condition, the untreated disorder can cause life-threatening bleeding such as kidney damage can occur in henochsclenon purpura. ITP can cause bleeding in the brain leading to permanent brain damage or death. The risk factor. Risk factor of this purpura includes blood clotting issue caused by medication or disease, infectious disease particularly among the children and the elderly, poor nutrition when it leads to a lack of vitamin C, some form of cancer such as leukemia and myeloma, inflammatory conditions and disorders such as Ehlers-Danlos syndrome, advanced age, poor blood vessel health. Prevention. The only effective method for preventing purpura is avoiding the condition that causes it. As most of these conditions are not due to the lifestyle of people or its factor, there is little a person can do to reduce the risk. Diagnosis. The purple spots of purpura are fairly easy to tell apart from other rashes. Purpura is not normally accompanied by itching or other common skin issues. Some tests are performed to exclude out confusion, such as CBC, that is complete blood count for thrombocytopenia. Bone marrow tests are done to confirm ITP, and other tests are performed such as skin biopsy. It is done to exclude the skin cancer. Urine test for protein and blood to confirm henochsclenon purpura. Other tests according to the symptom. Now the treatment. It is usually based according to the underlying